Hello, my name is Jamie. I'm the genetic counselor here at Impact Genetics. The following video is an interview between myself and one of our patients that chose to undergo prognostic genetic testing for uveal melanoma. We go through a little bit of detail regarding what types of samples are required for this process, what types of analysis are done during the genetic testing, and then go on to explore a little bit about why Joan chose to pursue genetic testing and the implications of the results on herself, her family, and her medical management. Following our interview, there is two short presentations from two of our ocular melanoma medical advisors, Dr. Bertil D'Amato and Dr. Tara McKennell. They talk a little bit about how prognostic genetic testing helps them within their practice and helps them stratify their patients into different risk categories depending on the results of their genetic test. At the end of the video, there will be an email address provided for you. I would be happy to answer any additional questions if you wanted to send me a quick email to clarify any questions that any of you may have. So I hope you enjoy this and it's helpful for you and your family to begin processing the importance of testing and how the implications could affect you in your own management.
Thank you, Jamie, for this opportunity. My name is Joan and I've been treated twice for ocular melanoma. In 2003, I was diagnosed with a choroidal tumor in my left eye and I was treated with radiation therapy. In 2014, a routine follow-up appointment showed that the radiated tumor had broken out in the original location. Immediate enucleation of my diseased eye was our only choice. And once I learned that prognostic genetic testing was an option, I requested it. So hopefully I can clarify why I made this decision and why I feel fortunate to have been able to do so.
Okay, well, let's review the diagnosis process. Patients who have a diagnosis of ocular melanoma will be seen by a specialist called an ocular oncologist. At this stage, treatment options will be discussed. Two typical treatment options are either the removal of the entire eye, which is called enucleation, or radiation therapy, which is directed on the eye tumor itself. Both of these types of treatment provide the opportunity to perform our genetic testing. Even patients such as yourself, Joan, who have had radiation treatment previously can benefit from our genetic test if enough tumor is present in the eye. The tumor cells can be analyzed immediately from a fresh sample or later from a sample that has been frozen for future analysis. If the eye removal is performed, a small piece of the tumor is collected by the pathologist and sent for genetic testing. If radiation is performed, a small piece of tumor is taken at the time of surgery prior to the insertion of the radiation disc, which is often called a plaque. Our test enables us to look at the actual DNA in the tumor. This tumor DNA can have specific alterations that are able to predict if the tumor cells have the potential to metastasize or not. Joan, how did you find out about prognostic testing and what made you opt to have it, even though it's not yet currently covered by most government or private health insurers?
When my tumor reoccurred, I was very quickly scheduled for surgery. So I went instantly into research mode and I found reams of information sources, including online support groups, where I discovered that genetic testing was an option in some jurisdictions. Less than a week before my surgery date, a post appeared on one support site that Impact Genetics had just announced approval of its new uveal melanoma test. So I immediately contacted you and my ocular oncologist to see if I was eligible and if it was even possible at such a late date. Both of you responded quickly to my queries and you helped to quarterback an amazing sequence of medical cooperation that included 3 ophthalmologists and 2 pathologists at 5 different hospital sites, as well as personnel from your company who made a lot of phone calls and actually hand-delivered the test kit. It was a logistical feat that would have rivaled any military operation.
At the beginning of the video, you described yourself as feeling fortunate, even though you lost your eye and your genetic test results indicated that you're at high risk for metastatic spread. Why do you feel fortunate under these circumstances, and why did you want to know your level of risk?
Well, before I answer your questions, perhaps you would like to explain how your test results identify a patient who is at high risk for metastatic spread.
Okay, Joan. Basically, the 4 chromosome alterations involved with these types of eye tumors are chromosomes 1, 3, 6, and 8. Chromosome 3 provides the most information. If there are 2 copies of chromosome 3, which is considered to be a normal result, the chance those cells will spread and become a metastasis is low. If the tumor cells show only 1 copy of chromosome 3, which is often referred to as monosomy 3, this is considered to be a type of cell that has a high risk to be aggressive and to spread to other parts of the body, mainly the liver, in this condition. Knowing which category patients are in can provide useful information to both the treating physician and the patients themselves. High-risk patients can opt for additional screening and potentially participate in ongoing clinical trials, while those who are in the low-risk category can continue on with regular routine screening.
First of all, thanks for that explanation, Jamie. When I made my decision, I was totally aware that this type of prognostic test could not change the path my disease might take, but that it could potentially prolong my life. Informed ocular melanoma patients know that there's currently nothing that will stop the onset of metastatic disease, nor is there yet a cure once it occurs. And herein lies the crux of the issue about prognostic genetic testing for this, and indeed for many other conditions. However, it can help doctors better treat patients with metastatic ocular melanoma and more effectively monitor those of us who are at high risk. And that's the fortunate part of my story. So it's probably best that one of your medical specialists and advisors explain how it assists them.
Absolutely. After our talk, Joan, we'll add a couple of clips from our medical experts. Would you care to share how you reacted when you got your results and how your opinion about prognostication may be different to other patients?
Jamie, I truly believe that the tumor which broke out a second time in 2014 was far more lethal than the original one, so I almost expected the result I got. Many patients and their caregivers prefer not to know all the details of their cancer's potential spread because it causes them endless worry and anxiety. For them, bad genetic news could be more terrifying than the original diagnosis, so they may opt not to have genetic testing. Well, for those people, other available options could include tumor tissue banking for future analysis and genetic counseling where it's offered. Other patients prefer to know everything because they feel that more information gives them greater control over their own lives, and I'm one of those types of people. For about half of us who undergo your prognostic test, we'll be assured with a high degree of accuracy that our tumor will not likely metastasize. Unfortunately, I'm not in that category because my tumor was tested as monosomy 3.
So how then, with the result that puts you at high risk to develop metastatic disease, do you still feel that your prognostic testing has helped you?
Yes, I do. Every cloud has a silver lining, and because I'm identified as a high-risk patient, I'm now eligible for increased diagnostic monitoring to catch metastases early when they're more easily treatable. And the monosomy 3 results from the test will also make me eligible for certain drug trials and targeted treatments if metastasis should occur. Your company's prognostic test helped me to accept the probability that my tumor may very well metastasize. And that was a very important step. And when I arrived at that stage of acceptance, I no longer needed to squander my precious time worrying if the disease would metastasize and spread. So instead of living in a state of heightened anxiety about an unpredictable and an even uncontrollable event, I can now focus my energy on more important matters, like staying healthy and like living each day to the fullest. And I have greater reason to interact positively and spend more quality time with my family and my friends and my community. I can learn as much as possible about my ongoing medical monitoring and about new treatments that may eventually help me. I strongly believe that up-to-date information better enables me as the patient to understand and to participate in any medical decisions that need to be made.
How has prognostic testing helped your family?
I think it's very difficult for families to accept these types of information. And at first, my husband really had difficulty dealing with the consequences of the test results. And it took a while before we were comfortable communicating openly and freely about its implications. And we now know that we need to make life plans in a timely manner rather than pushing them way off into the future. And that includes fun things like holidays, as well as the more serious decisions that any couple needs to make. The reactions of our 3 daughters ran the gambit from medical curiosity to fear of knowing the results to wanting all the possibilities and probabilities placed on the table right up front. The most positive outcome is that I can assure all of them that my chromosomal mutation cannot be inherited because it's a somatic cell mutation specific only to the tumor. And that fact is vitally important for our children to know.
So in summation, Joan, do you have any concluding remarks about your decision to undergo prognostic genetic testing?
I do not regret in any way having made my decision. Prognostic genetic testing has helped me to face and to plan for my future to the best of my ability given the current circumstances. And so for that reason, I'm indeed fortunate to have found Impact Genetics when I did. And I'm thankful to all the medical and the scientific people who made the testing possible. I would highly recommend prognostic genetic testing to anyone who is dealing with a new or a recurrent diagnosis of ocular melanoma.
Most patients want to know what kind of melanoma they have. They want to be empowered to look after themselves, both with regards to their personal affairs, if they've got a business or things like that that they want to sort out, and also to make sure that they have the best chances of survival by making sure that they have screening tests, that they find the best the best oncologists, and if they're denied that opportunity, patients very understandably get upset. A very important principle of medical care is informed consent. So that means that when patients are treated for uveal melanoma, they need to be informed not only about the different forms of treatment, but also about the genetic testing that exists. And there are many patients who are never told about genetic testing, perhaps because their ophthalmologist doesn't believe in it. And then they find out afterwards from their friends, they go on the internet and they communicate with other patients, and they find out that they were deprived of that choice, and they get very upset about that, understandably so. So it's really, really important for all patients to be told about the possibility of having genetic testing of their melanoma. There are many ophthalmologists who say, what's the point of doing genetic testing on a uveal melanoma and finding out that it's going to kill the patient if there's no treatment? But what they're forgetting is that most patients with uveal melanoma have got a good prognosis, have a melanoma that's not life-threatening, or probably not life-threatening, or almost certainly not life-threatening. And it does them a lot of good to know that their melanoma is not as dangerous as the name would suggest. Because for many patients, a diagnosis of melanoma is a death sentence. And thanks to genetic testing, a lot of patients find out that their tumor is not all that dangerous after all. And it does them a world of good. On the other hand, if the patients find out that their tumor is highly lethal, ophthalmologists feel that it's going to be extremely traumatic, and it is difficult for them to accept that news. But when I've spoken to patients, I've asked them if they regret knowing that. Nearly all patients have told me, although it was difficult, they needed to know, they wanted to know. They didn't want to put their head in the sand and just ignore reality. And the psychological studies that we've done have shown that uncertainty is very stressful. And even a bad prognosis, in a sense, is less stressful than total uncertainty about the future.
The prognostic test is going to give information that's going to tell a patient what the likelihood of their developing metastasis is. And there are patients who will have a low risk of developing metastatic spread, and there are patients who have a high risk for developing metastatic spread. Overall, if you take all comers of patients who have uveal melanoma, there is at least a 50% risk of developing metastatic spread. And with longer follow-up, we believe this number to be even higher. So having prognostic information is very important for the patient to understand their cancer. It's important for the ophthalmic oncologist, as well as important for the general oncologist who will be helping to monitor these patients, so they also understand the level of risk. An oncologist may want to use that information to alter their surveillance of metastasis with follow-up imaging, and it's also helpful for the patient to understand if they have a more or less aggressive type of cancer. The other factors that we look at in addition to molecular prognostication are some traditional clinical features of the tumor, which we still find helpful. And probably one of the most important characteristics remains tumor size. So the smaller the melanoma, the better the prognosis is, and the larger the tumor, the more high risk there is that the patient may develop metastasis. I believe that together with size and the molecular result, we can better predict which patients may develop metastatic disease. For example, a patient that has a very small tumor but is found on molecular prognostication to be at high risk would have a better prognosis overall than a patient with a larger size tumor with a high-risk marker. So we use various features, but the molecular marker, I think, is a very important and a very objective way of establishing a patient's metastatic risk. At this point in time, the result of the molecular prognostic test serves probably two main things. One, it gives patients information, and we and others have established that patients want information. People want information about their health and their cancer so that they can make appropriate decisions about the rest of their life. In general, people feel more empowered, and when people have less uncertainty, they're able to move forward and conduct themselves in ways that are beneficial to their overall health and life. In addition, knowing the prognostic test result can help guide systemic surveillance for metastasis. And although we don't have any treatments at this moment that may be helpful for patients with high risk, there are ongoing clinical trials of an adjuvant nature so that a high-risk patient may enroll and receive medication before they actually develop metastasis. And as we continue to learn more about the biology of uveal melanoma, my hope, and I believe in the very near future, we are going to be able to offer a more targeted systemic therapy for patients at high risk from the outset. So I imagine that we will soon be able to treat our primary tumor, know the molecular features by the tumor biopsy, and offer a patient a treatment that will help either suppress metastasis or prevent it from occurring in the future. And this is what we're, in all areas of cancer, we're striving to reach a point where we will be able to offer more targeted treatments based on tumor biology. And obtaining molecular prognostic information today is really the first step at getting to that point with our treatment of uveal melanoma. I think for many decades we have not made much progress in our ability to treat metastatic disease or help alter the course of metastatic disease in these patients. And understanding the biology and moving forward with therapies that depend on the tumor biology is where we're going to be able to make the most difference in treating these patients. When it comes up that a patient may actually learn about the prognosis of their tumor through a biopsy, in our experience, it has definitely been the case that people want this information. On a gut level, it seems obvious that we would want to know how aggressive our cancer is. But until we actually performed studies with our health psychologists, we weren't able to be sure of this. We looked at patients who had previously received prognostic testing, as well as a group of patients who were treated before prognostic testing was available. And we asked the question, would you have wanted to know the prognosis of your melanoma, even though it would not affect your medical management? And we found an overwhelming 97% of patients would have wanted this information. And the reasons for wanting this information were to have information so that they can make decisions that would affect the rest of their lives. We have found that having a poor prognosis is not detrimental to patients in general. In fact, having a poor prognosis offers the patient the ability to have a reason for making significant changes in their lives and it gives patients a reason to make changes in their lives which will benefit them in the future. For example, a patient who was found to have high-risk melanoma, she felt that it was important to have that information so that she could spend more time with her family, visit her grandchildren, and do things that she enjoyed. And we find that having this information somehow gives people the power to make these major things and gives people the power to make major changes in their lives, which they normally wouldn't otherwise.